If you find yourself thinking that if I have sexual concerns, I can just take a pill for that, or I'll just use those sexual strategies and I'll be fine, it may be helpful for you to know that it's not always as straightforward as just taking a pill. If you're really focused on getting your erections back, you might find that it's simple to think about just using a strategy. But what we find is that only about 50% of men actually use a pill for erectile concerns. And of those, even those who are finding it's effective for giving them their erection, they often stop using those pills within a year. What this means is that it's not easy to sustain using erectile treatments. There's an art to communicating with one's partner, to managing side effects and drawbacks from taking these medications. And there are different ways that we can think about adapting. So sometimes men think, I'll just work on the pill and get that back on track. But also, there are other ways to think about this. One of our studies looked at men who had had prostate cancer treatment and the different types of adaptation strategies they used when it came to establishing sexuality and intimacy within relationships. We found one group of men that were really focused on an individual-based approach. They didn't really engage their partner, they just kind of focused on what they needed to do. And half of those men engaged in a really strong focus on trying to get erections back and using medications. They often focused on masturbation and trying to use these strategies to get erections going again. Another group of men focused on just accepting that this is the way it is, things have changed, I guess I won't be able to have erections anymore, and it was almost like they were resigned to this outcome. I guess I won't be able to have erections or sex. There was a separate group of individuals who were really couples focused, so not individual focused. These couples were also divided into two groups. One where sexuality was really emphasized, and one where it was more minimized. So similar to the acceptance group, they may have decided, I guess sex isn't going to be the way that it was before. It's not a top priority for us. There are lots of ways we can feel intimate and connected with one another without focusing on sexual activities, and we'll just focus on how to maintain a strong couples relationship without sex being a huge priority. The other group focused on what we call sexual renegotiation. So they really focused on how can we maintain a sexual relationship even if it looks different. These couples did often use erectile medications and treatments, but they were often more successful because they used a variety of different strategies. And when the erectile medications didn't work, they had other things to fall back on. So these were couples who focused on non-penetrative sexual activities and ways of being intimate with one another and sexual with one another that didn't necessarily require erections. These were all four categories of people who adapted to sexual changes. There was also a group of people who didn't adapt, who struggled and were frustrated. And they tried things and they didn't work and they didn't find a solution or an outcome that left them feeling like they had adapted to sexual changes. So keep that in mind as you think about the journey ahead for you. There are many different pathways, some that are really focused on the sex piece, others that are focused more on the relationship, and others that are focused on adapting and coming up with new ways of being sexually satisfied.